On your study as well, one of the studies as well, that I had read in there, they
Okay.
were implementing, hold on, 30 or 30 hours over the span of 5 weeks for the
Mhm.
dosage. Who
Okay.
determines dosage for
It's a
the?
good question. Yeah, the study designers did that. So it really depends on, well, let me be completely honest here. This is full transparency. Many of the ways that the actual studies get designed is constrained by the funders that actually uh, kind of put constraints on the studies. So, for instance, if you have a big 5 year R1 grant, you can do an extensive study. But if you have a limited study window, a limited amount of budget, you have to constrain certain studies. And this is one of the big rate limiting steps for most neuro-rehabilitation investigations. And so some of them were constrained to smaller time frames. The larger studies that we did were about in the 100-hour range, 3 month windows. That's our typical range is around 90 days, 3 months or so, hour and a half a day, which kind of goes up to that 100 to 140-hour range on average. So those are the typical kind of ranges that we want to go for. If you think about the minimum amount that is kind of going to induce a positive change, right around that 30-hour mark is probably what we would expect to see as kind of that minimum criteria for seeing some minimally viable clinical important differences. So that's what dictated that first one of those smaller studies we did that had that 30-hour window.
So and now, so just kind of putting that into perspective of an
Yep.
individual patient that's being consulted, will that, following that 30 hours for 2 3 months, how effective can can somebody who had
Mhm.
been who have experienced stroke for like 3 years now, um, having range of motion problems with her range of motion, like what is a person like the percentage
Within
of like
days.
effectiveness that she can see,
Mhm.
um, with just 30 hours, or is it more of it just depends on the patient, regarding to how
Sure.
often you use the machine?
Sure. Yeah. So I think these are great questions. I'm gonna do my best to answer them, but I'm gonna have to go over to Peter in a second. But let me take a quick stab at this, and then I'll be sure Irene and Timothy and Elmo will be sure to get all your questions answered. So don't worry about that. Um, I just want to be respectful of Peter's time as well. And so, with regard to, there's two things here. One of them is the idea of chronicity, and that is, can we still expect to see changes after a 1 year post stroke? And because that's the classic time frame when people say your physicians might say, oh, after 6 months or 1 year, that's what you have basically. Good luck. That is, we just know that's patently false. I keep saying this time and time again that there's a, a plethora of scientific studies that have investigated people who are many years post stroke. And some of those are even ours, right? Most of what we've done has been focused on individuals who are chronic stroke survivors, and we still see meaningful improvements in people's function. So that's a period on that. Now, when you look at what you can expect in terms of like, Irene will have X improvement under these conditions. For me personally, and any reasonable ethical scientist would say they can't make that. They can't state a specific number. And the reason being is that's not what science does, unfortunately. I would very much like to be able to say, we put these values into an equation and this is going to be your outcome. We're working towards that and we're getting better at that, but we're not there yet, unfortunately. And let me just justify something really quickly and say that science works on aggregates right now, because when you do a big randomized control trial, you have two groups of people usually, or in a simple sense. And what you want to do is you want to see on average across these types of stroke survivors, what's the sort of improvement that we see over X period of time. And so what we could say is on average, after a 3 month period of using the Motus hand, where people are doing it around an hour and a half a day for 5 days a week for around 3 months, basically 30 hours a week, 35, or 30 hours a month, 35 hours a month, we can see what are called minimally clinically important differences. And that's a step above in my book beyond just a simple statistical improvement. So we did have statistical improvements, of course, but the clinically important differences are the things that matter most. And that is, could you notice that you have an improvement. It's not simply that my actual test is sensitive enough to see a subtle change, but are you going to be able to see a difference? And so for many of these measures that we use a battery of tests, and many of these actually look at the number of tasks that you can do. And then we quantify whether or not you can do them under the same speed, and you can generally do them quicker after that 3-month period, but it's really, can you do more of those tasks? And what we see is after that period of time, most individuals can do more tasks. So that's kind of the big thing for me, is that now the patients that I work with are able to do more things with their upper extremities, or in the case of the lower extremities, they're able to walk twice as far and twice as fast. And those are kind of the nuts and bolts. So that's really quite some of the evidence straight from those studies. So hopefully you guys can kind of ingest that a little bit and think on that. Yeah.
Right. Thank you.
Yeah, of course. So thanks so much, Irene, Elmo, and Timothy, and I will be right back with you guys momentarily.